So this next technique is known as an abdominal breath or diaphragmatic breathing. And what we're doing is focusing on a slightly lesser used part of the breath to try and improve it. So we said that breathing occurs in three parts. Diaphragm drops down to fill the lower part of the lungs. Rib cage moves out to fill the lungs generally, and then the breastbone lifts and that fills the top part of the lungs. Now, because of restricted clothing and working at desks and driving, we tend to be quite rounded, and what that does is it makes it difficult for us to get air into the base part of the lungs, and the diaphragm tends to be restricted. So we spend a lot of our time simply breathing in the higher reaches of the lungs. And so this type of breath is occurring in the top part of my chest, and I'm having to breathe rapidly because I can't get enough air in. And that's quite typical in general, but it's also typical of certain respiratory conditions, such as asthma or chronic obstructive pulmonary disease. So these exercises that we're using to train the respiratory system and to train your breathing capacity can also be used clinically. So this next method then is the abdominal breath or diaphragmatic breathing, and we're going to do this in two methods. And I'm going to turn on to the side so you can see what's happening. So, sitting in my cross-leg position with my feet supporting my shins, and I'm lengthening my spine. So I'm going to put my hands on my tummy, and I'm going to try to imagine that there's a balloon under my t-shirt. So when I fill the balloon with air, naturally it would get bigger. So as I breathe in, my tummy should protrude, and as I breathe out, the balloon would get smaller and become squished. So as I breathe out, my tummy draws in back towards the spine. So the sequence is a little bit different than people often think. So when I'm breathing in, I want to relax and allow the tummy to do nothing. As I'm breathing out, I want a little bit of tension in the tummy. And that becomes difficult because we tend to spend a lot of our time in gyms focusing on sit-up type movements, trying to get rock hard abs and a flat tummy. But for this practice, we actually want relaxation in the abdominal area, and we want to see the muscles moving, and that will be a little bit like if you watch a dog sleeping, where the tummy moves up and down, up and down, up and down. So it's coming out and it's going back. So hands on the tummy, imagine there's a balloon under your t-shirt. Breathing in, breathing out, breathing in, breathing out. Now, as I'm doing this, I'm breathing in through my nose, but I'm breathing out through my mouth. And the reason for that is that by breathing in through the nose, the air is warmed and moistened. By breathing out through the mouth, there's less resistance, so it becomes a little bit easier. Once we become practice, we can breathe in and out through the nose itself. Let's try again. Imagine there's a balloon under your t-shirt. Breathing in. Tummy relaxes and expands. Breathing out. Tummy draws back in towards the spine. Breathing in. Breathing out. Breathing in. Breathing out. One hand on the tummy. See if you can do it without the hand. Look down towards the mat. So that action of the abdominal breath is drawing the air right down into the base of the lungs, into an area which hasn't been used that much. And as we become practiced at that, we can actually use the force of the abdominal area to move into the next type of breathing, which is called the bellows breath. And the bellows breath is a more advanced technique, and this is where we use the diaphragm.